Understanding telehealth laws, impact on healthcare access. Imagine being able to see a doctor without leaving your home, but wondering if the laws allow it. That's where understanding telehealth laws becomes important. These laws decide how, when, and where you can get healthcare through technology. They also determine how providers get paid for these services. Telehealth laws set rules for who can give care remotely. For example, they specify which healthcare providers like doctors, nurse practitioners, or therapists are allowed to offer telehealth services. Currently, Medicare, the federal health insurance program for people over 65, lets many providers deliver telehealth and get reimbursed until at least September 30, 2025. This includes video calls and sometimes phone calls for behavioral health, making it easier for patients to get help from home. Another key part of these laws is defining originating sites, or where patients can receive telehealth. Recent laws have expanded this to include rural hospitals, federally qualified health centers, and rural health clinics. This means patients in remote areas can now access care without traveling long distances. It helps reduce barriers for those who might otherwise go without care. Credentialing and licensing are also important. Providers need to be licensed in the state where the patient is located. Telehealth laws have introduced credentialing by proxy, which allows a provider to be credentialed through a hospital or health system remotely. This process makes it easier for providers to offer telehealth services across state lines, especially in rural areas where there are fewer healthcare professionals. Remote patient monitoring is another aspect regulated by telehealth laws. It involves using connected devices to track health conditions like blood pressure or blood sugar levels. These laws ensure that patient data stays private and that providers can be reimbursed for using these tools. This helps keep chronic conditions under control without frequent visits to the doctor's office. Mental health teletherapy benefits greatly from these laws too. They allow for audio-only sessions, which means patients can talk to therapists using just a phone. This is especially helpful for those who lack internet or prefer not to use video. It makes behavioral health services more accessible for many people. Setting up telehealth appointments involves using approved technology platforms that protect privacy and meet health regulations. Patients usually need a device with internet or phone access. Providers must verify who the patient is and get their consent before starting the session. In summary, telehealth laws influence healthcare access by broadening who can deliver care, where they can do it, and how they can do it. They support the use of technology like remote monitoring and audio-only therapy to reach more people. These laws also simplify provider licensing and credentialing, making it easier for more professionals to participate. As these laws continue to change, especially after temporary flexibilities expire in late 2025, healthcare providers and patients will need to stay informed to keep access open and smooth.